You are watching Hot Springs Village Venues. Hello and welcome back to another episode of Village Venues with Mr. Brian Kulis.
Hello.
Today we're going to talk about
Medicare, I think.
You think so?
Is that what it is?
You do.
That's right.
I hear you on the radio. I see
Right.
the billboards up and down the street, and apparently, who knew? But you're our local guy.
I am. That's right.
And with a what kind of phone number?
It's a 922-7449 Hot Springs Village number. So 501-922-7449.
Yeah,
Yes.
That means a lot. It really does. And you know the value in today's society with the pandemic and all the craziness we're seeing.
Right.
It's so much more important to have somebody. You know, something will go wrong. Eventually, there will be a mistake, there will be a whatever, or a change in policy.
That's
and to
right.
be able to call
Yeah.
back and talk to the exact same human and go, remember when we talked about
That's
blah,
right.
we
Mhm.
need to fix that. And, you know, we talk about that with the pandemic and all the
Sure.
changes. We've literally seen a tremendous number of people moving into the village.
We sure have, from all over the country.
And
They're
how does that
moving here.
affect anything? What, I mean, does theirs transfer, or what do they have to do?
Well, if they have a Medicare plan in another state, quite often they need to switch plans when they get here. So they have about a 2-month time frame when they change addresses to come here, and I can help them transition to a new plan.
Well, now, so it doesn't have to be October the 15th through December the 7th or whatever funky day?
No, let's say they move here in February of the year. They're going to have about 2 months to make changes. So I'll sit down with them in March or April and transition them to a new plan. Let's say they had a California Medicare Advantage
Right.
plan. They had maybe a supplement and a prescription plan in California. We may need to change their prescription plan to an Arkansas plan or switch their Advantage plan. So
How do they know they have 2 months? I mean, is that just a known given or what?
Yeah, most people don't know. They just know they have to make that change. So they can call me and I'll say, hey, you're good. We have about 2 months time frame and we need to meet, and I'll sit down with them and, oh, by the way, maybe have a cup of coffee if that's possible.
Maybe coffee. Maybe coffee.
Maybe coffee. So we can change the plans over and I'll help them transition.
It sounds even more critical to have a local agent.
That's right.
That you know that you can call, and
Right.
things can go wrong or there's changes to be made.
They can go wrong, and networks change. A lot of the Medicare plans change every year. Doctors are in and out of network, and hospitals are added and deleted, and so I really try to keep abreast of everything going on in the market.
Sure, and a lot of training to do that, right?
A lot of training, yes. I sit and watch a lot of videos, do a lot of Zoom calls, and that type of thing, and go to meetings at hotels and eat Danishes and coffee, and watch presentations. So
And rubber chicken.
And rubber chicken.
rubber chicken.
The rubber chicken circuit, right?
Yeah, exactly. So we talked about people that are moving in,
Yes.
and that's, for us, that's been a real big thing.
Right.
And if I'm not mistaken, just a Hot Springs Village, the fine folks at Balboa Road Baptist Church said last fall, there were something like 840 new families.
That's amazing.
I mean, we've never had
Right.
That's
Yes.
going to be probably 10% of the entire village.
That's right.
And that was last fall.
Wow. And I get calls every day about somebody moving to Arkansas and they don't know what to do. They say, "Hey, Brian, help me transition to a new plan."
Yeah.
And if they do have maybe some type of group healthcare plan that they're still on, I'll give them an honest opinion and say, hey, maybe it just behooves you to keep that
Yeah.
for a while, and we can, compare the prices to a Medicare plan. Maybe they're still 70 and still working. Maybe they have a group healthcare plan. They moved to Arkansas. I'm going to give them an honest opinion. Hey, you need to keep that group healthcare plan, and then when you quit your job here in Arkansas, then we'll transition you. So.
And it's a new world. I mean, because you're talking about that, I'm thinking,
Right.
I know 70-year-olds that are still working remote.
Oh, absolutely.
And they've
Yes.
moved from California, from Colorado, from New Mexico,
Right.
from Texas, or wherever.
Right.
And yeah, they're still employed, but they need to change their health care over or be prepared to.
Right. COVID's changed so many things. So many people just working remotely from their homes, and they come to the village or Central Arkansas, and they have a home office in their spare bedroom, and they're working. They still kept their California or Minnesota job, and they're still working. You know.
We actually have a friend who lives on Lake Balboa this has been about 4 or 5 years ago.
Right.
But he actually worked at Tesla and would commute 1 week a month back and
Oh,
forth to Tesla. And
that's
the other 3
interesting.
weeks he was an engineer.
Oh, wow.
So can you imagine being
Yeah.
an electrical engineer and sitting and looking out over Lake Balboa and then, okay, I got to go to work. I got to fly.
Right.
I got to fly to California
That's
to work
right.
at Tesla.
Nice.
So and you hate to bring this up, but there are people who have been disabled
Yes.
that need to get on the program too. What do you do for those?
That's true. I mean, even a young person, 25, 30 years old, can be put on medical disability. And typically medical disability is for 24 months.
Oh.
And then after 24 months, typically they will get Medicare automatically. So
Really?
let's say you have a 30-year-old person, 55-year-old person, they're on Medicare for 24, or I'm sorry, they're on disability for 24 months.
Right.
I can put them on a Medicare plan after that. So I get calls, hey, my disability is ending. I need to get into a Medicare plan. So that's also a special enrollment period any time during the year. Or maybe it's March, April, May
Really?
of the year. As long as their Medicare disability is ending, we can enroll them in a Medicare plan.
So it sounds like I need to have a friendly number of 501-922
74.
7449.
That's right.
Ready at all times, because
It's ready.
I just never, and everyone would hope disability would never happen.
That's exactly
but
right.
It happens all the time.
It does happen. Somebody has a heart attack, a fall at work, injury at their job, that type of thing.
Yeah, sure. It happens all the time.
It does frequently, yes.
Yeah. So what if I'm just, new to Medicaid? I've just never had a need or never qualified before. What happens?
Are you talking about turning 65?
Well, yeah, but I could be 70 and now it's just time to get Medicaid or whatever.
That's right. Yeah, you could be 65, new to Medicare. You could have just quit your job. You're 70 years old. You've retired at 70. Maybe you're 72 years old and you've just retired. That opens up a special enrollment period. Whenever your group insurance ends, then you can get a Medicare plan.
But that's not the. And it's crazy that the government picks out October the 15th through December the 7th.
Exactly right. Yes.
Somebody somewhere is going, hey, I picked out this October 15th
That's right.
through December. That was mine.
I got a big bonus for it.
I got that one. Yeah. Crazy dates for no apparent reason, but that was mine. But you're saying, so if you're new to Medicare, there could be special enrollment periods?
Special enrollment periods any time during the year. That's correct.
Really? And how long does that last? Or
well, if you're leaving group insurance, let's say you're leaving group insurance, June 30th is your last day.
Retiring, and
You're 70 years old. That Medicare plan could start July 1st for you, and we can start talking 2 months ahead of time, get you signed up, so you're all ready to go by July 1st. So you transition from group insurance to a July 1st start date, and I can get you into a Medicare plan. You just moved here again, about 2 months time frame when you change addresses. So they can call me in February. They can call me from California and say, hey, Brian, we're going to be there in May. We could do everything over the internet and phone. I could have them. Yeah, I could have them ready to go.
Except for coffee, you couldn't do phone coffee over the
internet.
internet.
Virtual coffee. I don't know the taste of that. Yeah,
messes up the microphones. Messes up the microphones.
Maybe they'll send me a package of coffee beans. I don't
like
know.
That.
Maybe
and you can grind them up.
I could grind them up. Those are some special enrollment periods. And again, on Medicare disability, if your Medicare disability is ending, let's say September, October, November, the next month after your disability ends, you can start a Medicare plan. So that's kind of a year-round, kind of a floating enrollment periods.
Well, and we've covered, I think, most everything, but I want to make sure I understand just the really simple basics.
Sure, right.
So is there any other way besides disability I can get Medicare before 65? It just doesn't happen?
Well, another situation is through Arkansas Medicaid. Now, some people do have Arkansas Medicaid.
Right.
And again, you have to qualify under a certain income level to get Medicaid. So if somebody applies for Arkansas Medicaid, which each state has their own Medicaid plan, for instance, Texas, Oklahoma, Arkansas.
Right. Other states that you're licensed in, by the way.
That is correct. And a lot of times, if they are on Arkansas Medicaid, they may also have disability and have Medicare. So they may have Medicare and Arkansas Medicaid.
Right.
There are different companies that offer a special Medicare Advantage plan that is made to give you extra benefits on top of Medicare and Medicaid.
Now we haven't dove into these, but let's cover real quick that there's the Advantage plan for relatively healthy people. and then there's a supplement plan.
Right, and typically supplements in Arkansas, you have to wait till you're 65 or older
Okay.
to get a supplement. There's a few that maybe on some disability situations you can get a supplement under 65.
Right.
Typically a supplement is over 65. Advantage plan can be, you can be 25 and 30 years old if you have Medicare. Maybe you have Medicare disability.
Right.
So you could be a younger person and actually have a Medicare Advantage plan.
Really?
And then you have Medicaid and Medicare in Arkansas. You could also get a Medicare Advantage plan.
Now, back me up for Medicaid and Medicare. I'm
Yes.
trying to understand because
Sure.
it gets confusing, and I know
It sure does.
We sometimes use them interchangeably.
We
and
do
they're
all the
nowhere
time.
close, right?
All the time, right.
Yeah.
So, yeah, Arkansas Medicaid is through the state of Arkansas, and again, you have to be under the income threshold to qualify
So
for
it's
that.
an assisted income type situation.
It sure is.
Okay,
And
okay.
some people also have Medicare with their Medicaid.
Okay.
So
Which is the federal program.
Right. They would have their Medicare card. They would have their Arkansas Medicaid or Texas, Oklahoma, what have you.
Right.
Many companies, for instance, United Healthcare is one that has a plan that works with Medicare and Medicaid eligible people, and that Medicare Advantage plan will give them extra transportation, dental
Really?
and vision, hearing aid benefit, over-the-counter benefit credit where they can order like vitamins and lotions and Band-Aids.
Really?
So this is over and above Medicare and Medicaid, and it works well. So that's just one that I could mention, right?
I keep hearing every time you say something, I keep hearing, call your local agent, Brian Kulis. Because, I mean, seriously, this is so complicated.
It sure does.
It depends is the answer. It depends.
It depends because, again, a husband and wife meeting with me, they may have totally different needs.
Oh, yeah.
In the
Different
same
health levels.
in the
different-
same household, right? And you don't. I could really never do a cookie cutter approach and say this plan is good for both of you. I've got to talk to you, sit down, get to know you, what your doctors are, what pharmacy, do you travel, do you stay in Arkansas all the time? You know, that type. I ask those questions. So
Which is great.
right.
Well, thank you for joining us again today.
Oh, you're
Brian.
welcome. You're welcome.
A font of knowledge, literally. For Hot Springs Village Venues, come see us again. With Mr. Brian, I'm Dennis Simpson. Thanks for joining. Thank you for watching Hot Springs Village Venues. Please stay tuned and follow us on Facebook to see the next episode.